So hi everyone, and welcome to What's in Your Sandwich lunchtime session. I'm Maura Connell. I'm Innovation Projects Coordinator here at CHI, and I work with Anne Quinn and Barry McMahon, who are also the innovation team of three. And today we'd really like to welcome you along. We're going to talk about the Innoavtion Seed Funding Call, and we're going to give you some information about that. And that was launched last Monday, the 15th of April. So I'm going to do a talk about that, let you know a few pointers about how to apply and some useful tips. And Sarah Carroll, psychologist from Crumlin, is also on the call, and Sarah's going to just share with us her experience of applying for the seed funding in 2023. And if you have any questions, you can ask them at the end. We're happy to take any questions. So I'm just going to share with you a few slides here. And now, sorry about that. So you can see that there. Stop sharing. Bear with me now. Sorry, guys. It's a bit of a tech issue here. And I'll share with you now. Okay. And just sharing there now. Yeah. So today, we're going to just give you a quick roundup about information around the CHI Innoavtion Seed Funding Call, as I was saying. And just in general, we try and do these monthly innovation What's in Your Sandwich talks on various topics, and we will be focusing on the Innoavtion Seed Funding Call, and Sarah's going to come in and give us a bit of advice on her experience of applying for seed funding. Just to let you know, for any other events we run, do log on to the MyCHI app or email us at chi.innovation@nchg.ie for information. We'd be happy to share any upcoming events with you or news that you'd like to know about. So I'm just going to give you a bit of background about the CHI Innoavtion Seed Funding Call. So back in 2021, thanks to the support of the Children's Health Foundation, research CHI went out with their first seed funding call, and they have three types of call. And then in 2022, Innoavtion were delighted to launch the seed funding grant call for CHI staff cross-site. So it was a bit of an unknown area in terms of uptake and the interest, and we were delighted that we received 11 applications in total. And of the 11, eight were shortlisted to go ahead to our innovation review panel, and we awarded 4 projects funding in 2022. And then in 2023, we had a slightly larger uptake of interest, and we had 12 applications received. 9 of those were shortlisted, really high quality applications, and 6 were granted funding in 2023. And that's all thanks to the Children's Health Foundation and the support they give CHI. So just to give you a flavour of some of the projects that were funded and the current successful project awardees. So we have Wesley Mulcahy, who was awarded funding in 2022. Wesley is the complex care coordinator in Crumlin for patients with 22q deletion syndrome, which is a rare metabolic disease, and not much is known about this disease. So basically, Wesley and Suzanne the consultant who looks after patients with 22q and Crumlin, saw that there was a need for more information around this metabolic disease, and Wesley co-designed a patient passport pack. And he really honed in on the co-production principles and co-designing the project with patients, family, and staff. And I suppose the empathy approach, which we really are strong advocates of in innovation at CHI, Wesley consulted with patients with 22q syndrome, and he did this through really creative ways at various workshops with them. And what came from that is a launch in February, and we just want to congratulate himself and Suzanne on that. And he launched the 22q passport pack. So we're really excited and happy about that, and are excited to follow up with him on the impact it has created for these patients, and the fact that it may be transferable to other disciplines. And then we have the respiratory team out in Tala, CHI Tala, Catherine Carrig and Mary Devitt. They're working on the children's asthma pack. So they initially developed a hard copy paper pack called CAP, Children's Asthma Pack. They produced an educational resource for children to manage their asthma. So they saw that there was a really great need for that for this cohort of patients, and they are really focusing on co-designing the children's asthma pack digitally, and that means working with nurses cross city in terms of what is needed, preferences, and also children and families and what they're experiencing currently. So that's really important, that you're hearing the needs of the end user, if you like, the person that uses, that is faced with the challenge, if you like. So they're co-designing closely with the stakeholders for that project, and they're after recently conducting one of their first workshops with nurses both regionally and at CHI, and they've got many insights into what is needed for the children's asthma pack. So they're still exploring that phase of the project. And then we have Sarah Carroll, along with her colleague in Temple Street, Jen, who is developing a central resource hub for supporting children with needle procedures. So I suppose the biggest fear for a child is needles in a children's hospital. So Sarah and Jen are trying to establish a central resource hub of resources to support children with needle phobias, and they're consulting widely with stakeholders about this and forming a working group at the moment. So that's really exciting, and to see what comes from that. So Sarah will be giving us a talk briefly after myself today, so we'll be excited to hear about her experience of applying for the funding. So the Innoavtion Seed Funding Award, what is it? You might see posters around your particular CHI site. So it was launched in 2022, and the CHI Innovation Grant really supports all clinical and non-clinical staff across CHI. And the funding is for projects up to €25,000. And with that funding, you would receive a dedicated project support from the innovation team and myself. So I work closely with the project teams throughout the 12-month project timeline to try and design a project plan that works around their schedule and building in the milestones that they want to reach. So that's a really important part, and a part I really enjoy about the Innovation Seed Funding projects. They're always changing. There's different types of projects, and I build up close rapport with all the teams, and if anything is not going to plan, I'm there to support them along the journey. And also, as part of the funding project, teams will have access to training and mentorship in terms of innovation practice, what that means in healthcare and design thinking. There's design thinking workshops that we run as well throughout the year, and you have access to that if you come on board as a project team. So really the purpose of the Innoavtion Seed Funding Award is to develop impact, and how is it going to be impactful for children, family and staff. So we want to create a positive impact. So and we want to aim at smaller, low cost or startup projects that can be executed in a short space of time. So it's a seed project. It's starting off small and building it up. And maybe in the future that might be larger scale, but for the purpose of this seed funding award, it is a project that's executed within 12 months. It's also aimed at an innovative idea, as I said, with a view to a larger funding opportunity in the future. So it's really piloting your idea and building on that. So you've probably seen these posters around your CHI site, or maybe not. So just to remind you that we launched the seed funding call last Monday, the 15th of April, and it's closing on the 22nd of May, which is about 3 weeks away. So do have a chat with us, get in touch, don't be afraid, and we are happy to answer any queries you have. So just to give you an overview of the innovation timeline in terms of the call process and how it works. So we launched the call on the 15th of April, last Monday, and the closing deadline is the 22nd of May. And then when it comes to May, we have submission of eligible applications to the Innovation Review Panel, and that's made up of senior management from CHI and also people from our innovation network. So there's the founder of a startup company and a member from the Spark innovation team. So very diverse group of people who will be judging the applications. And then a decision is made in June, all going well, by the Innovation Review Panel in terms of the successful applicants. And then we move on to summer months, July and August. Successful applicants are notified if they have received funding or not. And also non-successful applicants are notified and given feedback as well in a constructive way if they're wanting to apply for funding in the following year. And that's endorsed then by the CHI Corporate Steering Committee. We come into autumn then, September 2024, and we hope to have project kickoff where the projects are initiated. And we have a kickoff meeting where all the projects meet up and we all get to know each other and find out how we're gonna coordinate meetings and work going forward. So really just to give you a roundup of what we mean by innovation and innovation projects. So it's a broad definition that we apply to innovation in healthcare at CHI. So it's we see it as any new idea that can be implemented to solve a healthcare problem or meet a healthcare need. So you're hearing the needs of the people that are experiencing the problem or challenge. And we base that on 4 characteristics. So if you're thinking of putting a project forward for the funding, think of novelty. Is it a new idea or is it something original where you want to interject some new twist to it? You see change is needed. We really hone in on empathy, as I was saying before. It's really important to hear the end user. So that being the stakeholder, if you like, children, families, staff at CHI, and hearing what their needs are. And feasibility, is there an end in sight? How can it be implemented as well in healthcare realistically? And how is it going to create positive impact? So you're going to design a solution that will hopefully be centered around having really meaningful impact for children and families in healthcare and staff. So just a quick kind of reminder of how to apply for the funding. So I would really advise you and encourage you to read the project guidelines, which are on the Grant Tracker website, the NCRC website. So really have a quick, a detailed look at them of what we would like to see from the innovation project. You can register on the NCRC Grant Tracker, which looks like this. And if you have Carl Egan, maybe on the call, Carl's the research grant manager. And if you have run into any technical difficulty, Carl would be the person to get in touch with. And we work closely with Carl on the innovation application process as well. So we're very lucky to have Carl working alongside us. Really complete all applicable sections on the form, read through them thoroughly. Get in touch with us again if you have any issues with that. You'll need sign off from your head of department, or if it's relevant for you, your line manager as well. And we also would like to for you to submit a 3 minutes max video explainer of your project idea. And we've used this in previous years for applications and found that it works really well because the innovation team and the innovation review panel can see the people behind the project idea, and it gives us a nice visionary of what the project is about. So just to remind you, that's where you will log on to apply for the Innoavtion Seed Funding, the grant management system, the NCRC website. And just to touch on the project budget. So when you apply for the funding on the application form, you'll see that there's 2 sections for the project budget, one being the innovation project management and project management guidance and support costs. So with that, just to factor in costing for project management support, you'll avail of a project support from the Innovation Projects Coordinator, that being me. So I'll work with you to develop your project plan, and in terms of the project deliverables, you'll have access to an in-house designer as well. There's also innovation training, mentoring from the innovation team, and other support materials that we can provide you with. And the other section of the budget part of the form is project-specific costings. So we would really encourage you to read the guidelines on this and look at the eligible and non-eligible costings for the budget. So just to highlight some there, the eligible costings being project consumables, small equipment. This has to be directly related to the project deliverables. Any outsourced services, for example, if you're running a workshop and you'd like to have a facilitator help you to run that, that would be eligible for costing. Computer software and licenses, and just to remind you that often licenses have to be renewed annually. So for eligible costing for the seed project, that would be only for the 12 months we would fund the license for. PPI, patient associated patient public involvement associated costs. So if you're again running a focus group or workshop and you have to factor in catering costings for that, that would be eligible. And if you're to produce something or dissemination costs for launch, that's also eligible. Non-eligible costings in terms of salaries, it's something that came up. We don't fund salaries for new staff, backfill or overtime for existing staff. And general office equipment like laptops wouldn't be part of the project budget that would be deemed eligible for to be funded. So just coming to the end of my talk now, I really want to say thank you to everyone for taking the time to come on the call and hear about the seed funding call. and spread the word. We do run innovation idea clinics across site. You can see there we have them coming up in Herberton next Tuesday, the 30th of April, Crumlin, Temple Street, and the IFSC as well. So do log on to the MyCHI app, where we update information there regularly, or get in touch with us. So the email address is chi.innovation@nchg.ie. So I'm going to stop sharing there now, and I'm going to soon pass it over to Sarah, who has come on today to talk to us about her experience of applying for the Innoavtion Seed Funding in 2023. So Sarah, I'm going to hand it over to you there, and I'm just going to get ready your quick slide deck there now. So if you can see that. Yeah.
That's very much.
Sorry now. So just bear with me there now. Here we go. There seems to be paused. So yeah. So go ahead, Sarah. Yeah. Can you see them?
Thanks a million, Maura. So just a couple of things from the last round that I found helpful. Certainly when we were doing, since we've been doing the project, as Maura mentioned, empathy is really key. Talking to people with lived experience, but I would actually say start that even before the application process. A, because it will earn you brownie points, and B, because it is genuinely, you don't have all the answers in your own head. So talk to your colleagues, talk to patients, and in particular, I would recommend you go outside of your discipline, because we can get into the echo chambers within our disciplines. The other thing, I only have two tips, but the second one is that the features of innovation projects, and actually Maura had those in her slide there, from the form, you'll see it's very, very clear how you fit into these headings. But for the video, I found a really good way to get it all down to 3 minutes, because it's not in my nature to get anything down to 3 minutes. I found focusing on these 5 areas was really, really helpful. And I think it actually helped me focus my thinking as well. So that's another tip that I would have. So if you want to move on to the next slide, Maura, I'll just go through how Needle Hub fit into those 5 headings and how I kind of put them together in terms of the presentation and the form. So first of all, identifying the problem, as Maura alluded to, kids all hate needles. Well, most kids hate needles. And what we found was that the existing initiatives weren't coordinated. So there's lots of great work going on in CHI, but they're not coordinated and people don't seem to know about them. So what really highlighted it to me was discovering this amazing video that had been on the play section of the Temple Street website that was like 7 years old, and it was narrated by Chris O'Dowd. Like, it was top quality, and nobody in the psychology department in Temple Street or in Crumlin knew it existed. So our aim was that we would try to get all of the resources centrally located. So in order to get a resource hub, we were going to try and get a people hub first, and that's brought us to the empathy piece. So that there was going to be, we envisaged a working group that not only comprised relevant professionals, but also young people and parents with lived experience of needle procedures as well, to inform us, and what sort of guiding philosophy might dictate which resources we selected. In terms of impact, what I did, and again, it was really helpful in focusing my thinking, but for the video, in terms of impact, I actually gave an example of what I felt a child's journey would be with Needle Hub in existence. So the idea was that a child, before they ever set foot in the hospital, when they get their appointment for their procedure, be it for example, a blood test, that they would be signposted to these resources. And it could be play resources for younger children, like colouring materials. Quite importantly, be like maybe a needle plan. And then when the child visits the hospital, some of the elements from the colouring materials or the games, such as the animals on the walls or some of the equipment used, would be familiar to the child. Then the child hands over to their needle plan. to the phlebotomist immediately recognizes it, and and the child is good to go. So that was how I gave an example of the impact. And then in terms of feasibility, I just demonstrated, highlighted that I felt it was more than feasible, because all it is about maximize the impact of work that is ultimately already being done. So if you want to go on to the next slide, Maura, thanks. And I'm so glad that I did it, because it has been absolutely fantastic. I think that the guidance that I've had and the ideas that I've had from Barry and Anne and Maura have been fantastic. What I would especially highlight, two things. The first is, again, it is that empathy piece. I came in, myself and Jen had this idea about who would need to be in our working group. And they were like, well, no, maybe you need to actually cast the net more broadly, using the analogy of a funnel, go out wide first. So we actually we put an expression of interest out to the whole of CHI. And it turns out we thought it would be psychology, phlebotomy and play, and that's all we needed to talk to. Turns out radiologists, radiographers, anaesthetists, they're all very interested. So we now have a working group that comprises parent representatives, psychology, phlebotomy, play, radiography, nurse education, nursing and anesthesiology. So we're absolutely delighted. The second thing that has been fantastic is accountability, because we all have our fingers in too many pies, and we're all overwhelmed, and various projects, I know various projects that I'm involved in, they fall by the wayside from time to time, and sometimes they fall by the wayside and they stay there, but that doesn't happen when you're meeting Maura next Thursday, and you kind of have to keep things on the agenda, and it's massively helpful. And then the process that we have, whereby these meetings are minuted, there's action points, there's Gantt charts, that sort of hold us to account, which I'm finding really, really helpful. And then finally, all I've met the people from the other 5 projects, and I found that really, really helpful. I find it really inspiring. I've actually made contacts that have directly informed our project. And also just seeing different people at different stages, that it's okay. This idea of going wide before you go bring it in and you focus it again, that can feel quite scary. When you're in a room with others who are going through that as well, it's a lot more,
Thanks, Sarah.
So thank you. Yeah, no, I've really enjoyed it.
That's great to hear from your experience. So we're just going to put it to the floor now. So if anyone would like to ask any questions, hopefully you have the function there, just to raise the hand, or just put your question into chat as well. So don't be afraid to ask any questions. We're more than happy to answer them. Okay, so Lucy Perrin, I think you raised your hand there, Lucy. Yeah, do you want to take the mic?
Hi there, can you hear me okay?
We can indeed, yeah.
And quick question around and I'm sorry, I did miss the initial few minutes of the presentation, so if this is perhaps covered, the sort of intersection between quality improvement and kind of direct patient initiatives versus kind of seed funding for research. Does this funding opportunity span both of those, or is research not really the focus?
So, do I come that more?
Yeah, sure, yeah.
Yeah. So Lucy, there's actually a research seed funding call as well that's open at the moment. They have a rolling call, so there isn't a closing date on that call. And we'll circulate the slides later, and you'll be able to scan the QR code and get more information on that. So if you're interested specifically around research, you could apply through the research call. The innovation call is so where quality improvement starts and innovation, where innovation and quality improvement intersect. It's quite hard to say what's in which category. I suppose the main thing for us is around novelty and impact. That's what we're really interested in. So if you're taking something that exists somewhere else and you're applying that as a quality improvement initiative, that's not an innovation project. But if you're taking something and you're adding a particular twist to it, or you're using it in a different way, then that can come in under the criteria for innovation. But we're very interested in innovation in terms of service innovation, process innovation, how we're looking at innovation, the experience of care for children and families, how we're looking at product innovation, and also in the device space as well. So we're covering a very broad area. So whether you see that as quality improvement or whether you see that as innovation are probably interpretable, but we're definitely looking for something that's new or novel. Does that answer your question, Lucy? Okay, I'm assuming.
Yeah,
Yes.
no worries. Maybe she dropped off the call. There was the tech issue. Does anyone else have any queries just on what myself and Sarah highlighted there? Yeah. Don't be afraid to put your hand up or whatnot. Okay, I think that's everyone. They're happy enough. If you are and you have no other questions, we're going to end up just ending the call. Thanks everyone for joining, and hopefully it has encouraged you to put your idea forward for funding. So we'd like to hear them all, so do get in touch.